Hello viewers, welcome to our channel. We were discussing about the causes of female infertility in our videos. Today I am going to discuss about one important cause which is affecting women's health not only during a pregnancy or pre-pregnant life and also in the menopausal life, fibroid uterus. Let me see the causes, major causes for the development of fibroid uterus in women. The first cause is genetic cause. If mother is having fibroid uterus, naturally there may be a chance of development of fibroids in their daughters. And another cause, having less than 2 children, I mean only one kid in their life, in their reproductive life. These women are having a chance of developing fibroid more. Then alcohol consumption, especially beer drinking women are having the possibility of developing fibroids. Precocious puberty, vitamin D deficiency, gestational diabetes mellitus, and hypertension, especially pregnancy induced hypertension as a result of twin pregnancy, triplet pregnancy through artificial reproductive techniques, and women having the habit of taking highly processed food and preserved foods in their lifestyle rather than taking homemade food or our nativity food, having the chance of developing fibroids. And major stress in their lifetime, I mean an emotional trauma. It may be due to loss of a relationship in their life, loss of son or daughter suddenly, or loss of spouse unexpectedly, sometimes divorce and separation from their spouse, and there is a compulsion on their women to lead their life without any support, I mean some sort of insecure life. These are all the possible causes for development of fibroid. But according to my practice and my clinical practice is being concerned, stress is the foremost cause, because when stress level is increasing, this is inducing the brain to order our body to produce more hormones. Especially in women, increased level of estrogen automatically results in the development of fibroid. So the stress is affecting the hormones and it's creating undue secretion in the women hormone. This results in abnormal growths in the uterus. Why this stress? Because of suppressed emotions. Some women are not having the chance of expressing their views or their knowledge in various circumstances. They are actually forced to control their emotions either in the family or in the official environment. This naturally in their later age, nearing menopause or after while crossing the 40 years of age, results in the development of fibroids in the uterus. Now let us see the symptoms due to fibroids. What are all the major symptoms? How to identify whether we are having fibroids or not, depending upon the symptoms experienced by the women, and if it is discussed with the doctors whom they are consulting, then through an ultrasonogram we can find out whether fibroids are developed in the uterus. Depending upon the location, they are having various types of fibroids: subserosal, submucosal, intramural, or pedunculated, whatever may be. The following symptoms may be experienced by the women: pain and prolonged menstruation, pain with prolonged menstruation, pain during intercourse, dyspareunia, profuse bleeding, continuous bleeding resulting in loss of blood and anemia, heaviness in the lower abdomen, constipation because of the hypertrophied uterus giving or exerting a pressure over rectum resulting in difficulty in passing stool, and stress incontinence. Due to heaviness over the bladder, there is an urge to pass urine frequently. Stress incontinence or micturition, frequency in micturition is increasing. Sometimes there may be involuntary urination too when sneezing, laughing or coughing, and pain in the lower limbs due to the weight, unable to bear the weight in the lower abdomen. When women are standing for work for a prolonged period of time, this results in pain in lower limbs and backache, low backache. Just like a pregnant woman, when weight is increasing in the uterus, there will be a dragging, pulling towards front. This is having a pressure over the spine and they will have low backache. In the same way, women having large fibroids in uterus are having low backache too. So these are all the major symptoms. Usually women will communicate to the doctor when they are coming to the clinic, when they are narrating their symptoms. So these are all the possible symptoms would be expressed by the individuals. So how the homeopathic approach is different from other hormonal therapy. I mean, instead of reducing blood supply with the help of medicines and controlling the growth of fibroid or myolysis. So other than these measures of controlling or hysterectomy, if the fibroid size is larger or if the woman is suffering from profuse bleeding, unable to control the bleeding in spite of hormonal therapy, then naturally women are forced to go for hysterectomy. So hysterectomy will result in calcium deficiency in women. Though calcium supplements are prescribed after hysterectomy, we cannot have a proper calcium balance in their bones. It results in osteoporosis or early deterioration of their bone health. So how to avoid this, how to overcome this without going for hysterectomy, how homeopathic management is helping women to come out of this fibroid and to get relief from the symptoms of the fibroid and getting control over the size of the fibroids. Because as I have discussed in earlier, the emotional cause is the major cause. I mean, the stress is the major cause. So this stress is actually creating a toxification in their minds and altering the hormones and inducing the excess secretion of hormones. So if the detoxification in their brain is possible with wonderful homeopathic medicines, naturally the hormones are getting controlled and the growth of the fibroids also can be controlled. So the mental symptoms or the psychological symptoms expressed by the women, it may be a loss of relationship, or it may be a fear in their mind, an undue fear in their mind, a sense of insecurity in their life, or emotional disturbances like insults, frequent insults by the family members in their life. Sometimes individuals are forced to control their emotions or suppress their emotions irrespective of their expectations. So these symptoms are taken as a totality, and along with their symptoms expressed by the patients. I mean, the sensation of the patients, the pain, type of the pain, and when the pain is increasing, whatever the situations under which they are getting some sort of amelioration from the pain, these symptoms will help us to select a well individualized homeopathic medicines and getting a tight control over the growth of fibroids. This could be possible by altering their mind symptoms and making them as a naturally healthy individual with good mental health. It's without having artificial control or without going for hysterectomy. This is very, very possible in the system of homeopathy only, having a tight control over the fibroid growth and even disappearance of fibroids in their uterus. This could be possible. Calcarea carb, I mean, I'll tell some of the homeopathic medicines which I have used successfully in my practice and getting rid of from this fibroid uterus complaints and facilitating the women also have a good conception, and also women who are in the menopausal age facing their menopausal periods without having much disturbance or pain from the fibroids. Calcarea carb, Fraxinus americana, Sabina, Sepia, Pulsatilla. Depending upon the location of the fibroid also we can select the homeopathic medicines on the basis of the symptoms expressed by the patients, especially the nature of the pain, the extent of the pain from the uterus, where and all it is the pain is radiating, and when it is getting better, what type of measures are helping them to get control over their pain. On the basis of this information, definitely on the basis of their mind symptoms also, we can arrive at a good homeopathic medicine which will be the individualized and single, definitely giving curative property in the women. I think it will be useful for you in your clinical practice also, and women who are experiencing such symptoms also will be having some sort of awareness. And one more precautionary method can be adopted by women. Women who are using dairy products or milk more in their life will not have vitamin D deficiency, and these women are having lesser probability of developing fibroid uterus. Stay tuned with us for the upcoming videos. Thank you.